All. This is Dr. Mubin Sayyed from drbeen.com. Welcome to one more show. So today we have requested David, who can read and I hope write as well Hebrew language. And I wanted to look at the data from Israel about these vaccines adverse effects as are reported from there. David or I are not actually making them up or presenting them, it is just the data that has been reported by Israeli Department of Health or Epidemiology, and we are going to translate it for us. It is actually very interesting data. I went over this with David before as well. So first of all, David, thank you very much for being with us.
Thank you, Dr. Drbeen. My pleasure.
So sorry, I got this call and got distracted. So David, would you like to tell us a little bit about yourself before we request you for the translation activity?
Yeah, of course. So yeah, I've been watching your channel for a long time. I'm a fan. We are neighbors of the same area. I'm based in the Bay Area as well. And I'm originally from Israel. So I'm happy that my Hebrew skills, are useful. And I'll be happy to translate the deck and, be useful here.
Excellent. So thank you very much. And yes, we are in neighborhood. So I'm here in Cupertino. San Jose is really nearby. When we go out driving, on the other side of the road is San Jose. So very, very good. Thank you very much for being here. So let's start our discussion. To the cool beans, the thing that I would request you to keep an eye on are the following. Number one, any clotting issue related to Pfizer, you would actually see a line item for that. Number two, any other neurological symptoms including Bell's palsy. And number three, in various age groups, what are the hospitalizations? That would be interesting to know as well. Why this data is important is that this is one of the largest populations data reported by vaccination. US has done a lot of vaccination as well in hundreds of millions, but that data is not available. Israel had struck a deal with Pfizer to say that when the vaccine will be available to Israel, they would also capture the data from Israel too. So with this, Luffy is here as well with his people's songs. David, please don't mind. Luffy is part and parcel of our discussions, and let's start. So David, so your translational skills.
I don't see a book written by David Sawyer in your library. To find audiobooks.
It seems like Alexa is joining the party.
Everybody is. There is a phone call, then there is Luffy, and there is Alexa. Cool. So David, what is this deck about? What's the title of this?
Oh, now my Alexa started. Alexa, stop. You see, my Alexa also wants to join the party. So this basically translates to effects which appeared adjacent to receiving the vaccine. Last updated March 1st, 2021. And this deck is by the Epidemiological Division of the Israeli Health Ministry.
Excellent. And so I wanted to just hone in on one word over here, and that is adjacent to vaccine. So what they're saying is this is adverse effects. So somebody who's going to put a comment down there saying Mubin only is talking about the adverse effects. This is adverse effects data, just to make us aware of what they saw over there. And secondly, they are not saying exactly it is caused by the vaccine. They're saying it is adjacent to vaccine. Many of these will be caused by the vaccine. So let's start.
Basically, a summary introduction slide. It says that the information here is updated for all reports that were gathered by March 1st, 2021. It says that the time that they take into account is 90 days from getting the vaccine doses. And it will be classified based on the type of adverse effect that was observed. And it also notes that, and again, I'm doing this translation in real time, so excuse me, everyone, if it's not perfect, but it also mentions that there appears to be an increased number of reporting for adverse side effects in women and young people,
which is very interesting. And two things over here. Number one, the side effects reported by the general population, larger population, has been a little lesser than what was observed in trials. And David, they have a comment about that as well, correct?
Yes.
And yes, please.
Yeah. So they say that it says it's not on this slide. I think,
but it's somewhere else.
Yeah. And what you have highlighted on the screen says that in adjacent to vaccines first dose, there were 9,595 reports out of for almost 4.8 million people who got the first dose.
Okay.
And in adjacent to the second dose, 8,743 adverse reaction effects out of 3.4 million or so people who got the vaccine dose. And the third highlighted line mentions that most of the effects were transient and not severe.
Excellent. So, guys, even when you cannot read Hebrew, here is the number 4.7 million and 9,595 adverse effects, and the second dose 3.4 million and 8,743. This is me trying to read Hebrew for you, at least the numerical parts of it. And then these are minor effects. All right, so let's continue here.
Okay, so this chart basically plots two graphs on it. It's the number. The caption is number of vaccine doses given in Israel since the vaccination effort has started. The blue line is dose number 1, and the orange line represents dose number 2.
And this is important for the whole slide deck. Orange and blue are consistently used to represent doses. So blue is dose 1 and orange is dose 2. So keep that in mind. As you can see right over here, we have orange and blue now.
Right. And the caption is, it's the classification of people who got the vaccine based on age group. So you see there like the different age groups.
So for example, if we read here 40 to 49. So it says that 40 to 49, 728,862 people got the first dose, and 473,803 people got the second dose. Correct? This is how to interpret that.
Blue is first dose, orange is second dose.
Second. So they say here, does this mean 19 and less?
And under, yes. So everyone 19 or less than 19, yes.
So are they giving, are they starting from 16 or maybe 18 as well?
Could be 18.
Yeah. So cool beans, this is the breakdown of the doses given to various age groups, starting from 18, 19, and up to lesser than 90 years of age.
This is great. So greater than 90. This is greater and over. 19 and over, sorry.
Got it. This is 90 and over.
Yes.
Sorry, so I read it in the other way around. So I get it.
That's right. Yeah.
So I know this one. I know this one. So one more color code over here. The purple stands for women and green stands for men. So yes, David, please help us.
You are correct, and you have perfect memory, Dr. Bean. So the right-hand chart says the number of people who got the first dose divided by age group and gender. And the left-hand chart is the number of people who got adverse reaction in adjacent to the first dose divided by age and gender.
Very good. So I'm actually going to hone in to one group, for example. Let's say this chart is showing 40 to 49 years of people, 372,208 women, and 355,511 men. So this is how the breakdown is. But if you go to this side for the adverse effect reported, you would say that in 40 to 49, the majority of or more adverse effects were reported by women compared to men. So if you see, you would see a similar pattern here. David, back to you.
Right, and actually call it out. So the caption under those two charts says that women and young people tend to report adverse side effects in adjacent to getting the vaccine in greater proportion than the relative share of the population.
Got it. Thank you very much. So once again, this is the proportion of men to women who receive. So almost pretty half and half. But then the reporting is slightly more reported by females and youngsters.
And this is the same for the second dose.
Okay. So once again, this is on the right side. So I think Hebrew is from right to left, correct?
Yes, correct.
Perfect. So from the right side, if we start, so this is the proportion of people by age. So down here is the age bracket. And then this color coding is for female versus males. So this is the number of people who received the doses, second doses. And here, if you see, this one is the adverse effects. Once again, as you can see that more adverse effects are reported by females. And does this say the same here as well, David?
So it says, females and younger individuals, young adults tend to report more adverse side effects than their share of the vaccinated population.
Got it. So then we are here.
And these two charts classify in general grouping, like the type of adverse reaction observed. The right-hand chart, is the total number, and the left-hand chart is based on per 100 million of vaccine doses given. And it basically classifies the adverse reactions into pain at the local site of injection, for example, general side effects, neurological side effects, and so on.
So can I then read this to say, and I'm just hearing you and then saying, so this over here are the local reactions, pain on the side.
Right, and the blue line is dose 1, and the orange line, it represents dose second dose.
And this is the total number out of given doses. For example, for all the folks who received dose 1, 4,256 of them had reported pain at the site of injection.
Yep, that's correct.
And then over here, 4,436 had reported, what is this written?
This is a general side effects.
Okay, general side effects. And then again, out of the first dose, which was about 4.5 million people, these are the neurological effects?
Yes, doctor.
487 people out of about 4.5 million reported that. And this is?
This is allergic and anaphylactic side effects.
Wow. So out of 4.5 million first dose, about 258 people who had allergic reactions or anaphylaxis. So allergy and anaphylaxis are actually treated differently, but reported here together.
And this final grouping is other severe side effects that are under investigation.
Got it. And then if I roll to the left side here, this is the percent, this is per million. Number, not percent, number per million, correct?
Yes.
So for example, the pain, if you are going to go for Pfizer, my son had Pfizer a couple of days ago. So now in my family, my son had Pfizer, my wife had Johnson & Johnson, I have Moderna. So we are kind of equal opportunity vaccine receivers. Over here, this is per 1 million. Let's say first dose, out of 1,897 people reported pain at the site of injection.
Yep.
Correct?
Correct.
And then is this the same?
General side effects. And yes, blue is first dose, and second dose is orange.
And this is neurological.
Yes. Yes.
So out of every 1 million, 102 people after the first dose reported neurological symptoms. And I think we can see some more breakdown later on.
This is the allergic and anaphylactic reactions, right? And
first dose had more and second dose had lesser count.
And this one is the exact translation is other significant side effects, adverse reactions, right, that are under investigation.
Got it. Very good. So generally, if you see here, both doses can cause these side effects. Usually, other than other considerations here, usually what you see is that with this, for example, 54 first and 34 second, this was anaphylaxis and reactions, correct?
Yes, and allergy as well, yes.
Yeah. So here, this one, pain at the site of injection, first dose is more, but then sorry, David, what is this one?
General effects.
General effects.
Fever.
This one, second dose more. Interesting. This is second dose more. Most of the other ones are second dose less. Okay, thank you.
Maybe because fever and such reactions, once the immune system is already primed after the first dose.
That's exactly it. That's exactly it. So now you are a cool bean doctor as well.
Oh,
So
I learned everything from you, so
Thank you very much. It is so much fun to go through this. Okay, so then not fun in a way that, of course, there are people who were the victim of these side effects. My reason is to actually be able to study from David and understand what is written here. So David, here on the right side.
Okay, so the caption is, if you could scroll a little bit up, there we go. Classification of side effects in adjacent to receiving the vaccine divided by age group for the first dose. Yeah, so this is basically the type of adverse reaction, but divided by age group.
I see. So for example, let's say if I am 50, for my age group, what reactions, so where do I fall here? In the gray bucket? And then what is this first group?
This is a local reaction in the local site of injection.
Got it. How about we go to the per million? I think that kind of makes it a little more clear. This is per million side, right?
No, this is second dose, actually. They don't do per million.
Second dose.
Yeah, first dose and second dose.
Okay, so then just cool beans, keep an eye on this number below. This is the total number of the first dose, 4.7 million. And then out of them, let's say for my age bracket, local reactions, 1,878. Correct? That is the way to read it, right?
Right, for the 40 to 59 age group.
And this group?
This is general side effects, fever
and this one?
Neurological.
Neurological. So interestingly, neurological side effects are less in red. This is orange, I guess.
I think this is the 90 and lower age group, if I'm reading it correctly.
So neurological side effects are less in youngsters. They are also less, and again, I do not know the breakdown of the actual doses given, that did the youngsters receive more doses or older folks receive more doses? Because if older folks received more doses, then it is possible that they would have a higher number of reporting as well. Well, so I do not know if the groups are equal in size. So maybe comparing them to each other may not be the right thing. So this is neurological adverse effects. How about this?
This is allergic and anaphylactic side effects.
Got it.
And the last grouping is the other severe category that is under investigation but not specified.
Got it. So then if we compare this to dose number 2, this is the dose number 2, 3.4 million. There are some numbers that are high here. So this is general?
No, this is local side effects, and the second group is the general side effects.
So general are much more after the dose number 2. Compare that to here. This is the general. And general are fever, myalgia, muscle aches, tiredness, fatigue, or systemic. So they are more after second dose. The others are occurring after the second dose as well. So this is neurological?
This is neurological, yes. Allergic, and the last one is the other significant under investigation.
Got it. So what I'm looking at, Cool Beans, as you are looking at these charts as well, I am looking at various trends here. That is there some specific age group, but without knowing the number of people who got it, we can't really say that this is too big compared to this number. Maybe this group was larger as well in general. And I'm going to quickly peek at the comments here as well to see if there is any comment or Doug is saying, who is following this? Doug, are you not following it? Denise. Okay, so cool. I don't see much questions here. Hopefully we are all following it. Cool. Moving to the next slide. Okay.
Okay, so this breaks down local adverse reactions for the first dose, which is the right-hand graphic chart, sorry, and the second dose, which is the left-hand chart. So it basically breaks down what kind of local adverse reaction was observed. For example, the bottom bar is pain. The one above it, yeah.
These three, yes.
Pain, redness or swelling, and movement restriction.
Got it. Got it. What are the others? I'm curious. My apologies.
No worries. It's local discoloration. This is lymph node enlargement, rash. Again, the exact translation might not be the right medical term, is underskin knot. And the last one is severe underskin tissue inflammation.
Okay. Okay.
And this one is the second dose.
Okay. So after the second dose, let's see which one.
This one is pain. The one above it is redness and swelling, movement restriction, lymph node inflammation, rash, knot under the skin, which I'm guessing the translation doesn't do the term justice. And this one is under skin inflammation.
Redness, okay.
Under skin discoloration.
Got it. Bruising, bleeding. So these are the actual numbers or per million, or how are these?
It's per million doses given.
Okay, so this is per million. And this was per million as well?
The difference is first dose in blue and second dose in orange.
Got it. So for example, if there are 3.4 million doses, so 322 multiplied by 3.4 total. So Sue has a question. Sue says, are these paired data points? Do folks who responded with allergy dose 1 still gets dose 2? Sue, that is a very good question, and I do not know if they are paired. That's a great question, because somebody who may have allergic reaction, my hope is if somebody had allergic reaction to the first dose, they would say, don't take the second dose. But it's a good question, and I do not know if we have an answer. David, do you see any comment in here that may have an answer to this?
No answer, but it makes sense that they won't give the dose to someone who had a severe reaction, I'm assuming.
Got it. Okay, so next slide.
So this is the same, but for the general adverse reaction category. So it breaks down specifically what type of general adverse reaction was observed. Blue is first dose, orange is second dose, and it's per million doses of the vaccine given. So let's, okay, and the labels are, this is general fatigue, headache, dizziness, fever, muscle pain, joint pain. This is vomiting and nausea.
Nausea and vomiting.
Yeah. Stomachache, chills, diarrhea, and this is passing out 0 to 30 minutes from getting the vaccine.
Fainting.
There we go.
Got it. So that, and this is per million as well.
Per million for the first dose, yes.
So the most common is fatigue and tiredness?
Fatigue and tiredness, the one above it is headache, and the one above it is dizziness.
Thank you.
And here it's a little bit different for the second dose in terms of it's general fatigue is the most observed one, followed by headache, fever. But this is where it kind of changes a little bit. So this is muscle pain, chills, joint pain, dizziness. This is nausea and vomiting. Yeah, stomachache, diarrhea. And this is new. This is enlarged lymph nodes. only appears to be on the second dose in terms of the
Yeah.
effects.
And just for the interest of the cool beans, why enlarged lymph nodes? So let's look at that for a second. And why especially after the second dose? So what happens is that when we give the first dose, so let's say this is the Pfizer vaccine. It is given. This is the first dose. And here is a cell. And the vaccine goes into the cell. This is the first time the cell receives the vaccine, makes spike proteins. Those spike proteins are chopped up in the smaller pieces. They are then presented on the cell surface as an antigen. This antigen is then, as we know, naive T cell arrives and kind of works with that, and then T helper 2 cells, T helper 1 cells, correct? And T helper 2 cell would cause a B lymphocyte to convert into a plasma cell, which is actively making antibodies. T helper cell would activate cytotoxic T cells. Cytotoxic T cells. Now, during this process, what happens is that copies of these cells are sent to lymph nodes as well. The copies are sent usually around the body, but wherever the infection is or wherever the injection is, in this case, more towards the close by lymph nodes. Lymph nodes are small structures in which lymph or immune system cells live. And lymph nodes are scattered throughout our body, and these cells live in them, and they are either memory cells or active cells. So now after the first dose, what would happen is that these cells that are being created here or made here, proliferated here, they would go and live in the lymph node as well. So some memory cells would come in and live here. Some T cells would live here as well. Then some macrophages, so let's say this is a macrophage. Some macrophage would have brought this antigen over here too, and there would be some lymph nodes, some immune cells, B and T cells, that would have become converted to active against this vaccine or the spike protein. Now, when the second dose is given, so let's say now the second dose is given, and here is a macrophage. Macrophage is going to pick it up and then take it right away to the lymph node. It is the same reaction like this is going to happen locally as well, but because we already have memory cells, they would rapidly step in and they would say, I already remember this thing, I'm going to start working. And as they're working here, they are working here as well. And what happens is they would start proliferating. Proliferating means they would start making their copies. Now we are generating an army. The way our body works is that it does not keep things around forever. It works with something, uses it, it makes it, uses it, and then destroys it. So now the copies are being made. This is called the proliferation. Now, here is why the lymph nodes swell up, because the number of cells are increasing. And here is why they become painful. The outer capsule of the lymph node is made up of tight connective tissue. So it is not very elastic. So when you try to fill that with cells, those cells don't have a lot of space. Hey, Luffy, they don't have a lot of space. So what would happen is that as they fill and they push on the walls of the lymph node, that causes pain. So lymph nodes swell up and pain occurs because the immune system that is trained against the first dose is now trained and is seeing the second dose and is responding. So this is actually a indication of lymph node immune system working. Luffy, can you stop? Okay. Luffy listens to me sometimes. All right. Thank you, David. I'm going to peek into the comments once more to see if we may have some questions here. Let's see. So, for example, Amandeep Singh is saying, I had enlarged lymph nodes after the second dose with headache. Yeah, so the second dose would actually trigger the immune system that was trained by the first one, and the cells are going to make their copies and they're going to fill these lymph nodes, and they're going to run around in the body as well. Luffy, I understand. So Carlos says, what is the rate of clotting per million? We are reaching there. So let's, Luffy is ticked off, yes. Excuse me, give me 1 second. Here is Luffy. So Luffy, what's going on? He's totally upset today. Okay. All right, so let's continue.
Okay. So this one is for allergic reactions.
So three things are important. Allergic reactions, I'm so sorry, David. Allergic reactions, blood clotting related things, and neurological. And we are going to discuss them all. Yes, David.
Sure. So this is the first dose. I'm assuming the next slide will be the second dose. And it breaks down the type of allergic reaction per million doses of the vaccine given.
Got it.
Yeah.
So are we reading from here?
Yes, we're reading from here. So the one with the most, the bottom bar is unclassified allergic reactions.
Per million.
Per million doses given, yes. And by the way, the table you see on the left is the total number of reported incidents. So you can go over that one as well if you want.
Okay.
The next bar is scratching, itching. Next one is feeling tingling, essentially.
Sorry, feeling?
Tingling, like tingling.
Okay, tingling sensation, yes.
Right. This is inflammation in the upper respiratory tract.
Okay. So inflammation of the upper respiratory tract, so this area, so sore throat, congestion. Okay.
Well, you'll butcher the name of what's here, but you'll need to help me, doctor. Urticaria.
Urticaria. Okay, so urticaria is on the skin, so that's a skin condition.
This is blushing or swelling of the face. Rash. Labored breathing.
So that means respiratory tract has become swollen. So when they're trying to breathe, they're finding it difficult to breathe.
Again, I'll need your help with the term. It's angioedema, local or systematic?
Angioedema. So the blood vessels have swollen up, and the blood is, or the, not blood, but the parts of blood, fluids from blood are oozing out. And so that is angioedema. Local and systemic.
Next one is anaphylaxis.
Okay. So there is anaphylaxis. This is per million, right?
This is per million, and the table shows the absolute counts on the left side of the slide.
Okay. So just to be clear here, 0.8 per million. So if there were, so almost 1% per million had anaphylaxis. Okay. So here, David, please.
Sure. So you want me to go over the table?
Yes, sure.
Okay. So let's start maybe from the bottom to work towards the top. This is the most number of reported incidents. So this is, again, unclassified reported allergic reactions. And this is totals.
Got it.
This is itching, scratching.
25.
This is tingling.
15 people. So this is out of all who received the dose. That is 4.7 million.
Yep, you see the number there. Upper respiratory tract inflammation.
Okay. So runny nose, congestion, sore throat.
Or urticaria. And again,
14.
sorry,
Perfectly fine.
There we go. I'm learning slowly. This is blushing or swelling of the face.
9 people.
This is rash.
9.
Labored breathing.
9.
The angioedema. Local or systematic, yes. And anaphylaxis.
4 people. So out of 4.7 million, about 5 million, 4 people. So about 1% per million, 0.8 over there, had anaphylaxis. It would have been great to understand, did they all recover? Were they all saved when they go into the anaphylaxis? I think we don't have that data.
And this is the same, but based on the second dose.
Okay.
So this is unclassified allergic reaction.
And cool beans, the second dose is 3.4 million, just a reminder.
This is itching, urticaria,
Urticaria.
rash, face swelling or blushing, upper respiratory tract inflammation, anaphylaxis, labored breathing, angioedema, local or systematic, and this is rapid pulse.
Tachycardia.
Yep.
So interesting that anaphylaxis over here, 0.9. Over here, it was 0.8. So almost the same in both cases. My assumption is somebody had anaphylaxis, they would not ask them to get the second dose. So this is someone who didn't have the reaction on the first dose, but developed anaphylaxis with the second dose. This is an assumption. I may be wrong. And this is
just letting you know that, so you see that there is like below this table, there is a blue text. So below the table, so this on the left side, below the table. So it basically gives you like, it says, it tries to explain the medical terms being used. And the one for anaphylaxis, it says severe life-threatening allergic reaction, which have been identified within minutes of getting the vaccine. Very rare. That's the translation there for the anaphylaxis one.
Makes sense. So that is the 0.9 over there.
Yes.
Per million. And so in here, there would be anaphylaxis here as well. Can you tell us what was the total number?
Sure. Yeah. So 3. That's the only 3 you see on the table. That's the anaphylaxis.
Anaphylaxis. So out of 3.4 million, 3 people had anaphylaxis. Got it.
Okay. This is neurological adverse reactions.
Got it. So cool beans, we just talked about the allergic reactions, now neurological, and then we'll talk about clotting as well.
So maybe starting from the table says total number of reported neurological adverse reaction in adjacent again the vaccine. This is dose 1, and the second line is dose number 2.
Got it.
Okay, so the first column, first column is tingling in various parts of the body, or loss of sensation would be maybe a more...
Loss of sensation or paresthesia. Paresthesia is a sense of sensation where sometimes it is hot, cold, no sense, itching sense, burning sense, or change in sense.
Right. Okay. And I think this one is Bell's palsy, I think. Palsy?
Okay, Bell's palsy. So Bell's palsy, dose 1, 59 people out of 4.75 million, 4.7 million, and the dose 2 is 3.4 million. So Bell's palsy actually 59 after the first dose, and then 14 after the second dose.
Right. This one is other neurological condition, like undiagnosed other.
39 and 20.
This is seizures.
16 and 7 seizures.
This is bitters, metallic taste in the mouth.
15 and 13. So one thing is clear that it happens with both doses. And my hope is, once again, if something severe happens to a person after dose 1, they would not give them the dose 2. So this probably is someone, for the dose 2, it seems like someone who got the dose 1 were fine, and then dose 2 had a reaction.
Loss of consciousness.
Yeah. And this is, again, my assumption. I want to keep making it clear. So loss of fainting, 8 and 6.
And this is transient ischemic brain event?
Yes. So transient ischemic attack, TIA. TIA and the strokes are basically inside the brain. So if I go to the drawing board for a second. So let's say this is the brain tissue. So if some part of the brain tissue does not, it looks like a, so if some part of brain tissue does not get blood for within 24 hours, it restores, becomes functional again, and is working again, then we call it a TIA. But if it becomes permanent, or if it becomes for longer period of time, then that we say stroke. So TIA, transient, that is why it is called transient ischemic attack, is actually a tiny stroke in the brain, which usually does not cause much damage. It just recovers within 24 hours. So after dose 1, there were 4, and dose 2, 1.
And the chart is the classification of neurologic effects, adverse reaction per million doses given, where the blue line is dose 1 and the orange line is dose 2.
And what does it say over here?
This says tingling, loss of sensation in various parts of the body.
Okay. So this is tingling or paresthesias plus tingling. What is this?
This is the Bell palsy.
Bell's palsy. So this is per million.
Per million, yes.
So out of 1 million people receiving the first dose, 12 developed Bell's palsy, and then 4.1 after the second. The question in my mind is that how many of them recovered and recovered fully? I don't have that data.
This is other neurological conditions, seizures, bitter metallic taste, fainting, and this is the transient
Ischemic attack. Interesting. 0.8 per million, so almost 1 per million. Okay, thank you very much, David.
Of course. And this one, if you can scroll just a little bit, there you go. So this is other, if you can scroll a little bit higher, just so I'll see the caption there. So this says other significant adverse reaction in affinity of getting the vaccine. This is per million doses given. And here they have categories for hematologic, infection, neurologic, and so on. We can go over all of them.
So I think over here we'll talk about clotting or something related to that.
Yes.
Okay.
So this was hematologic. And this is low pellet count. I think
so platelet. So is this the thrombotic thrombocytopenia?
Yes, that's the one.
Okay. So this is interesting. Now we're talking about Pfizer. Remember a few days ago, what was that? AstraZeneca or the Oxford study, I shouldn't say AstraZeneca, Oxford study came out where they said, hey, AstraZeneca has clotting, but Pfizer and Moderna also have it. And I have been thinking since then that in the US, at least, we didn't hear of it. So here you are seeing one report from Israel about Pfizer and possibility of clotting. So what is the number here?
Okay, so we have 4 columns. This column is basically the reactions when the first dose was given. And then the second column, which is interesting, it is the expected rate of this being diagnosed in the general population who got hospitalized between 2017 and 2019. So like incident rate in hospitalized people between 2017 and 2019.
So they compared the incidence rate in the vaccinated to the folks who were between 2017 to 19 to just see what did they see in general population.
Right. And then the third column is the same just for dose number 2. And again, it's like the expected rate based on hospitalized data, hospitalized patient data during 2017 to 2019.
Got it. So now if I try to read it, this is the thrombotic thrombocytopenia, or as we've been calling it, clotting issue. Here, 0.6 per million. Now, Oxford study had said that Moderna and Pfizer were 1.4 per million, and the AstraZeneca is 1.5 per million. Here, the data from so the first dose is 4.7 million, and 0.6 is the rate here. The second comment, which again I do not have an answer for, the second comment is this: in the general population, out of 1 million, 19.6 are expected to have clotting. Here in the vaccinated, we only see 0.6. My conjecture is that this is because we are seeing them within 2-3 weeks or 1-2 months. Usually this 1 million is seen in the whole year. So maybe these folks, just in general, some of them would still get clotting throughout the years. But soon after the vaccine, the clotting that they developed was 0.6. So if I was sitting here and attributing it to vaccine, then this may be the kind of number that may be attributable. And dose 1, 0.6, dose 2, 0.6. The number here, 19.6 expected, number here, 13.8 expected. And the difference is because dose 2 was a different count. They had given it to 3.4 million people, plus I'm sure their epidemiological data is different as well. So when you equate them, then the number would be lesser here. So interesting for me to see this, that Pfizer says 0.6 per million are possible to have clotting. This is compared to Johnson & Johnson, if you see, that had 6.8 million doses given and 6 people, so that was 1. So almost there. That was lesser than 1 as well, 6.8 million and 6 people who got clotting. 1 person died, 1 was in hospital. What I do not know over here is if anyone died and if somebody is critically ill in the hospital. But important data here. So thank you, David. What is next?
This is infection related. The first subgroup there is like sepsis. And the word means non-reported.
Got it.
So much less than the general population, like the numbers appear to be much lower.
Yes. So 0.2 over here. Again, one of the reason could be the time frame, that this may be expected 54.5 people out of 1 million are expected to develop sepsis. Sepsis is infection in the blood, and compared to that, 0.2 in the vaccinated.
Right. This is herpes zoster.
Okay, herpes zoster. 3.2, 32, second dose 0.3 and 21.3. So again, please keep in mind the time window.
And this is herpes simplex.
Okay, herpes simplex. So 0.8, 12 in general population, 0.9 after the second dose, and 7.4. So this is actually, of course, the vaccine itself is not bringing in any infection. It is possible that as the vaccine triggers the immune system, bothers it, and makes it busy, maybe opportunistic infections take a bounce. They bounce up.
Okay.
Got it.
Yeah. The next category is neurological, where the first adverse reaction is double vision, diplopia.
Diplopia. So diplopia is what would happen is either the eyes would not be aligned correctly, or the processing will not be happening correctly because the nervous system signal is not going equally fast. So if I draw this quickly over here, so let's say this is one eye, this is the other eye, optic nerve comes out of it, then some part of it would cross over, some part of it would go this way, some part would go this way, and some part of this would cross over. So that is how the optic pathway is made. That inner part of the optic nerve goes to the other side, and the outer part goes to the same side. Then they go and they relay here. Then after relaying, they make optic radiations. Then they go and relay in the brain. So diplopia can occur if the eye is not aligned the same way, both of them. And that can happen because the alignment of eye is also controlled by the neurological system and the muscles and the nerves to them. Or it can also occur if there are issues with the nerve on the way. And so this conduction speed is not the same.
Next one is acute hearing disorder.
So issue with the ears.
Next one is
what I do not know is that, sorry, David, what I do not know is that if this would be tinnitus, no idea, but something to do with the ears.
Yes, it says the exact translation is sharp disruption in hearing. That's the exact translation, word by word.
So that must be blockade. Okay. Doesn't sound like tinnitus.
This one is weakness and severe pain in the shoulder.
Okay, so shoulder weakness and pain.
And this one is face, severe weakness or pain.
So that is Bell's palsy. So am I on the right one?
Yes.
So Bell's palsy, same thing over here. In 1 year, out of 1 million people, they expect 5.2 to develop Bell's palsy. What I do not know is it 1 year, or are they saying from 2017 till 2019? In 2 years, we expect this. I do not know that. Or
That-
could be saying,
bottom, by the way, on the bottom of the slide, it says the following. It doesn't. I'm not sure if it's helpful, but it says the comparison data is for people aged 16 and above for a time period that it is identical to the months when the vaccine were given. First dose 3 months, second dose 2 months. Is that helpful?
that helps a lot, because then my theory that this may be the number for the whole year versus this number just for 2-3 months is wrong. And if they see in general population, let's say 5.2 people per million to have Bell's palsy, and then they see 0.2 over here in the same time frame after vaccination to have Bell's palsy, then it is interesting. Then is it helping in some way? I think it is not helping. It's just that some other folks are developing it, which are not counted here. So 0.2 versus 5.2. So that means out of every 5 million, there would be 1% developing Bell's palsy. And with the second dose, nothing.
None reported.
Very good. Not reported. Yes.
This is blurred vision.
1.9 and 6 and 0.9 and 4. So blurred vision is also important. My wife, after Johnson & Johnson, she went through, so nothing intense, but she had headaches, joint pains. She had them yesterday as well. Then she did develop blurred vision. She developed swelling of one of her eyes. She's much better. Blurred vision is gone. But she had a percolating set of these things. Okay.
This is that was the blurred vision. The one below it is Guillain-Barré syndrome.
Guillain-Barré syndrome. Okay. So GBS over here, 0.6 per million. So that means about 1% in 1.8 million vaccinated. Expected is 23.5. Again, I cannot figure this out yet, and that may be my ignorance, that 23.5 versus 0.6. Why? If this is expected in 1 million, then that should be expected here as well. Anyways, not reported after the second dose.
Right.
Got it.
This is okay. This is respiratory. That's the category. The first one is lung tissue inflammation.
So lung inflammation. So 0.2, 2 expected, nothing after the second dose, and 1.3. So out of 5 million people, 1 person may develop the lung tissue inflammation. After second dose, nobody. So that's actually a good number.
This is lung edema.
Okay. So edema in the lung. So water fluids accumulation in the lung. This is more scary. Congestion, you can say as well. So not reported after the first dose, and reported 0.3 after the second dose.
Right. And the numbers in the places are much higher.
Yes. Yes. So 204 expected, 138 expected. And the other interesting thing for me is that if you compare these numbers as you are reading them or seeing them, keep comparing them to the clotting as well. So clotting, and the second one over here somewhere was the Bell's palsy.
Yeah, Bell's palsy is, let me find it here. It's, well, where can I find it? This will be under neurology,
Bell's
right?
palsy will be the jaw weakness.
Oh yeah, so this one. So the one you're on right now, that's significant weakness and pain in the face.
Yeah, so this, I would take this for Bell's palsy. So 0.2. So lower numbers. Got it.
This is acute respiratory distress syndrome.
ARDS. So this is actually acute respiratory distress syndrome. is the actual scary thing that even the virus can cause. So after the first dose, nothing, which is good news. Expected in general population of the same size with the same window of time, 137.9. And after the second dose, 0.3. And again, why is 0.3? My conjecture, we don't have more data than what is here. My conjecture is that second dose may have triggered the immune system so much that the reaction was present, which caused a congestion in the lungs as well.
And doctor, do you think it could be that because Israel was also on severe lockdowns, that people staying at home gets exposed less to the environment, so maybe that's why the rates of certain diseases would be lower?
That is true. Yes, absolutely, absolutely.
This is the category is eyes, and this is retinopathia.
Retinopathies. So retinopathies are, if I go back here, back of the eye has retina, right? So this is retina here and retina here as well. So any damage to this area or any issue with this area is called retinopathy. And that would cause interference with seeing.
Mm-hmm.
So 0.2 in the vaccinated first dose, so that means 1% out of 5 million, and then 0.7 expected in general. Not reported after the second dose. These are interesting things for me that not reported after the second dose, and 0.4. So if you don't know Hebrew, at least you can look at these things over here and see that many of these are actually not reported in the second dose.
That's right. And the final category, it's internal organ damage. First row is severe damage to the liver, and the second one is to the kidneys.
So there was actually damage to the liver and kidney after the vaccine. And again, the thing that I'm missing here, just like in Netherlands, when the vaccines were given, some older, fragile people actually became a victim to the vaccine side effect. They didn't say it was this vaccine side effect, but what happened was their body could not handle their own fragility with the side effects. So here as well, maybe it is that kind of a situation, but without knowing the cases, I can't really say. So 0.2, this is liver, I believe.
Yeah, the first one is the liver, yes.
So 0.2 out of a million, 2.9 expected, nothing after the second dose, 2 expected. And then the renal damage, 0.2 out of a million, first dose, 171 expected, and then nothing after the second dose, 112 expected. This data is not making sense to me yet. I'm sure that they would have a follow-up data somewhere, but this is how it is reported.
And the caption, this blue the blue words in the box says there wasn't any adverse reaction that was observed which increased over what we would expect regardless of getting vaccinated, essentially.
Got it. So can I translate that into saying that what they're saying is after vaccine there was nothing that became more than expected in the general population?
Yeah, exactly.
Got it.
And some additional categories here. The first group is cardiovascular.
This group.
Yeah. First one is supposed to be heart attack, which is like blockage of the heart muscle, right? So
that is the infarction, myocardial infarction, yeah, or heart attack, correct. So 0.6 people after the first dose per million compared to 569.5 expected after the, not after the first dose, expected per million in the same time period. And then over here, second dose 0.3 and 375. And this was a very interesting data point here in the California, in Cupertino area as well, or this area, Bay Area as well, that they said that lesser people reported heart attacks. So just like we are social distancing and masking and keeping ourselves clean, and the flu and other common cold things have gone down, similarly, it is also interesting that either people are not going to hospital out of fear of going to hospital and catching COVID, or they are actually working from home. They are little more relaxed than the office environment, and they have less heart attacks. And just to back up this, there is a Monday morning blues that is known. And secondly, which So there is a sadness that comes when people start going to the office. Secondly, the largest number of heart attacks in the US are on Mondays when people are preparing to go to their offices. So very interesting that heart attack are 0.6 versus this.
Second one is heart failure.
Okay.
Is there a reason they're not grouping it together with the heart attack category, or?
Yes. So heart failure is where, so let's say if somebody has a healthy heart, so let me make it, so let's say this is a healthy heart. Like this. So in a healthy heart, when some part of the tissue becomes damaged, that is infarction or heart attack. So blood is not reaching here. Somehow this part of the tissue got damaged and we have a heart attack. On the other hand, heart failure can actually be one severe form of heart attack. Heart failure is just heart unable to provide enough blood that is needed for perfusing the body. And that usually is when somebody's heart is already enlarged, for example, and it is already, heart failure can be enlarged or hypertrophied both way. Generally, let's say that when somebody's heart is already not compensating properly to perfuse the body, and then you top it off by stressing it out further, then the heart can simply give up, and that is heart failure. So 0.2 versus 730, not reported versus 490. This is, again, this needs to somehow make sense. Okay, what is the next number?
So I Googled it. It's vasculitis, which is like
vasculitis. So vasculitis is just like when we get damage to some part of our body tissue and it becomes swollen and inflamed and red. Similarly, blood vessels can become swollen as well because their walls are inflamed. So that inflammation of the walls is called the vasculitis. Vasculitis has its own issues. It can close down a vessel. It can cause severe pain. It can start thrombosis in the inflamed vessel and so on.
And the next one, this is pericarditis.
Pericarditis. So vasculitis, if we go back for a second, not reported after the first dose, expected 7.3, 0.3 reported after the second dose per million, and expected 4.5 per million. And now is pericarditis. Pericarditis is, of course, the heart has a layer around this that kind of purses it. It kind of makes a, so as with the lymph node, you saw that there are coverings around our visceras, around our organs. And you can say that our organs are wrapped in small bags. So this small bag over here is the pericardium. And if this gets inflamed, that would be called pericarditis.
Okay, so one row above. Yeah, there we go. This is inflammation in the heart muscle. Oh, that's what we talked about. Sorry. Yes. Next one, I'm probably gonna mess the name up, but it's cardiac tamponade.
Yeah, cardiac tamponade. So cardiac tamponade is when the heart ruptures a little. There is a tiny defect in it, and that causes the blood to leak out of here and collect in this purse outside that we were just talking about. So this little pouch outside, blood would just come and accumulate here, and that would be the tamponade.
So it's interesting that they broke it down to so many, to such level of granular detail of
I love the data here.
Like heart conditions, right?
Correct. And I love this data. 0.2 in 1 million vaccinated, 3.1 expected, not reported after the second dose, and 1.8 expected.
This is ventricular fibrillation.
So ventricular fibrillation is that this lower part of the heart is the ventricle. So this is the ventricle. Ventricle, when that starts just not pumping, normally it pumps like closing the fist and opening and closing and opening. And instead of doing that, if the fibers are just randomly twitching, then that would be fibrillation. It can cause death.
Next one is stroke. So the one below you, this is the ventricular fibrillation. This is stroke.
Got it. So stroke again, stroke in the brain, 1.3 per million. That's a high number. Expected to 501 versus 0.3 per million for second dose and 326.
Let me Google the name so I can make sure I'm translating it correctly. This is pulmonary embolism.
Okay, so pulmonary embolism is when there is, ideally this should have appeared in clotting as well, because pulmonary embolism is going to be similar thing. So what happens is when some clot gets stuck in some part of the lung blood vessel, and that blood vessel cannot then supply further, and so this is the area of embolism, and this is pulmonary embolism. So
Next.
what is this, the pulmonary embolism?
No, this one.
This one. So 0.2 per million versus 60 expected, 0.3 per million after the second dose versus 38.6 expected. Got it.
Next one is pericardial effusion.
Okay. Pericardial effusion is a similar thing, just like the tamponade, but most of this cavity here becomes filled with pus-like material. So most of this becomes filled. So that is effusion. And that can cause, it resolves, but it can cause death as well, if not controlled in time.
Right. Next one is arthritis.
Arthritis, pain. So not reported after the first dose, 0.3 reported after the second dose per million. So that means 1 out of 3 million.
Next one is loss of sense of taste or smell.
So after vaccine, so we know that loss of sense of taste and smell with the virus is possible. Here we're talking about the vaccine itself. So out of 1 million, 1.1 people who were vaccinated developed it. Expected is 1.4. After the second dose, 1.2. Expected is 0.9. So interesting that even vaccine can trigger loss of sense of taste and smell.
Right. This one is inflammation of the appendix.
Appendicitis. So not reported after the first dose, 0.3 after the second dose. 0.3 per million, that means 1 out of about 3 million.
And this is acute thyroid inflammation.
Not reported after the first one, so thyroiditis, 1.6 expected, then 1 out of 3.2 million-ish after the second dose.
And this is multiple sclerosis, and in it says 1 reoccurrence and 1 new diagnosis.
So multiple sclerosis, we have talked about it in the past as well. So what happens is in multiple sclerosis, let's say this is a neuron. We know that neurons are covered. Hey, Luffy. Neurons are covered by myelin sheath, covering, just like our electrical wires are covered by a sheath. This myelin sheath is necessary. It's not just for the covering to protect the neuron. It is actually a very interesting thing. This myelin sheath allows the nerve conduction, or the signal that is traveling in the nerve, to become fast. If the signal goes throughout the nerve, it would be slow. So what happens is signal goes here and then jumps here and then jumps here and then jumps here. So this is called jumping conduction. And the other one is called, I think, solitary conduction or something, walking conduction. So this, if somehow the myelin sheath, this is Luffy, if the myelin sheath gets damaged, so let's say this myelin sheath cell becomes damaged. If it becomes damaged, then for the conduction to occur correctly becomes a problem. And so what happens is, instead of the nerve impulse traveling So let's say the myelin sheath has damage to it because of inflammation or because of other issues. So now either the signal is not going to go any at all, or it would walk through the nerve instead of jumping through it. And when it would become slow, then we have a problem. So imagine that my hand, all fingers have different nerve fibers, and the fiber for, let's say, my index finger has an MS on it or has nerve damage. So now when I try to close my hand, it is possible that this finger is not closing and the rest is closing. Or when I'm trying to open, then this is not opening correctly and the rest is opening. So that coordination starts happening. When it happens to the eyes, then we would get issues with the vision and so on. So here, 0.4 per million. So about out of 2.5 million, 1% developed MS, multiple sclerosis. Expected is 59.7, not reported after the second dose. Expected is 39.3. Got it. Anything else that is interesting here?
No, again, it says that there was no increase in the occurrence of any of those conditions based on previous data that has no relation to the vaccinations. And it also said on the bottom of the slide that there are some additional significant side effects that were reported but are not listed because the Ministry of Health does not have the general occurrence in the population data to correlate with. So they have been omitted from this slide.
Got it. So this is probably the reporting.
Yes, this basically says when folks who got adverse reactions from the vaccine, who they came to get help, if it's like the doctor of care or the ER or just like going to the emergency room versus to urgent care, for example.
Got it. Got it. So what is the most common one after the second dose?
So second dose, this is the one. It's per million doses given, and this is unclassified.
Okay.
This is the doctor of care.
Okay, so they called their doctor. How about the first dose? Most common.
Most of them called it their doctor. Yeah.
Got it. Interesting. So they went to their doctor. They called their doctor.
These are reports for hospitalizations adjacent to receiving the vaccine based on age group and number of pre-existing conditions.
This is a very interesting graph. So if I'm getting it correctly, David, please correct me. What you're saying is here, the age group is down here, for example, 60 to 69. And you had said that green means no comorbidity.
Right. Yellow means 1 and gray means 2 or above.
Got it. So I would read this group here like this. After the first dose of vaccination, in the group of 60 to 69, there was one person hospitalized who had no comorbidities. There were 2 people hospitalized who had at least one comorbidity or had one comorbidity. And there were 11 hospitalized that had more than 2 or more than 2 comorbidities.
Right.
So if you see here for cool beans here, what is interesting is all those folks who had comorbidities, their bars are higher. But once again, I do not know the count. How was the vaccine given? Maybe they were given more and the others had less. I hope not in this higher age groups at least. But if there is that equivalency issue, then these numbers would not be right. Assuming that all got similar number got it, then comorbidities, then vaccination actually causes issues. But without knowing either the percentage or knowing the number who actually got the vaccine, this, what I just said, may be not correct.
And this is the second dose.
This is the second dose. So same thing. So over here, for example, in 80 to 89, after the second dose, there was nobody hospitalized who had one comorbidity or no comorbidity, 6 hospitalized who had 2 or more. Same for 70 to 79, same for 60 to 69, 50 to 59, there was one person who got admitted to hospital who had one comorbidity, and then similar other here.
This is interesting that there are no comorbidities in the 19 to 29.
Yeah. Yes, there is nothing here. Or maybe they didn't have the data. How is that here, over here as well? I think they may not. So, all right. So I think what they're saying is when we reach 90, we will have comorbidities. So there is no data of 0 comorbidity or 1. That is the same thing here as well. And that may be for this at, hey, once we go, anyways, that's the data. And here we are.
That's it.
Excellent. David, thank you so much.
My pleasure.
I was looking at this whole deck like a child. So let me just quickly look at the comments here. And if you can answer a few questions, or alternatively, we can come back for a chit chat. So Cool Beans, tell us, would you like to continue here with the chit chat, or should we come back later and have David as well, or just do some questions and then move on to tomorrow? Janet says, Luffy has been tweeting this out. No one believes me. Luffy has been a brat today. I had to hold him to make him quiet. So once I held him, he was okay then. That's all he wanted. So I don't see any immediate questions in this vicinity. So we will then stop and we'll come back. David, if you like, you can come back as well and participate in chit chat, or if you like, you can take an off as well too. And somebody wrote here, Dr. Drake Ramore, David seems like a nice chap, by the way. So David, you have been approved by the Cool Beans.
The famous Dr. Drake Ramori from France. Yes.
Yes. Cool. So Cool Beans, thank you very much for listening to this talk. Please like, subscribe, and share. And there are 3 links in the description. If you would like to support this work, you can use those links. And I would come back in a few minutes for a chit chat. Thank you very much, and bye-bye.
Cheers.
David, thank you very much for being here.
Pleasure, Dr.